Hi, I'm Malika Sadani and I'm the founder of the Moms Company. C-section versus normal delivery. There have been a lot of talks around the rising cases of Caesarian these days. Today, we'll be talking to Dr. Makhija to know more about her thoughts on the same. Dr. Makhija, we've been hearing a lot in the media as well as between moms that there's been an increasing cases of Caesarian seen in the last couple of years. Why do you think that is the case?
See, there are multiple reasons for the increase in the incidence of Caesarean. Some of these reasons are justified medically, and some of them are more social than medical. Now, in the medical reasons comes number one, the reasons which are where the indications of Caesarean are definitely there, which means that the mother or the child may be at risk. So these are, and since Caesarean has become such a safe procedure now, so nobody would like to take any risk with the mother or with the baby. So the risks that we were taking earlier, we don't take those risks now. We would rather ensure that the baby and the mother go home fine. So those are your medical reasons. Then there is a social reason. Now there is a small family norm. Everybody wants to have only one or two children. So they want to ensure that the delivery of the baby is very safe. They want to make sure that the baby doesn't come to harm in any way. So if there is even a slight complication during pregnancy, these people actually ask for a Caesarean, saying that, look, we're going to have only two children. Why should we take a risk? And then Caesarean being such a safe operation now, why should they want to take that risk? So that is the social factor. Then the third, and which is a very, very common factor, especially amongst the highly educated and the more well-to-do women, is this thing for demand for a Caesarean. Okay. So this demand for a Caesarean has been internationally called CDMR, Caesarean Delivery on Maternal Request. Now this is a very major chunk of Caesareans that are happening in the elite people or the more educated people. Now they have various reasons for this. One of the reasons is fear of labor pains. Correct. That seems to be the main and the biggest reason. Then another reason is convenience. You can time your delivery. Correct. She's a working lady. She wants to time her maternity leave. She has certain important assignments to be done. So she wants to time herself. So that becomes another reason. Then in India, you have something as ridiculous as astrological reasons. Yes. So you have Caesareans by Muhurat. So all these things are adding on to the increasing rate in Caesareans. A lot of these can be reduced, and some amount of it are not reducible because we want better quality of children and we want less risks to the mother.
So how does a normal delivery compare against a C-section?
Well, I mean, a normal delivery is a physiological phenomena. It's a God-made procedure. Ever since women were there, they were delivering babies. Right. Caesareans only came to be there much later. A Caesarean is a surgical intervention. So obviously anything which is a surgical intervention is likely to have its repercussions. It is likely to create problems for the mother. It is likely to give her certain amount of pain. Although there is pain during normal delivery, but that pain is short-lived and it does not leave a long-lasting effect.
Correct.
And once the delivery is over, the mothers always forget their labor pains because of the joy of having the baby.
Correct.
So there is really, if you ask me, there is no real comparison between a surgical intervention and a physiological phenomena. A physiological thing is so much better.
Now that you bring it out, I remember the case. So I had normal delivery with both my daughters, and I don't think I have any memory of the pain that I went through. So yes, another question I had for you was that is there a difference in the post-delivery care that a mom who's had a C-section versus a mom who's gone through normal delivery?
Oh, there is a world of a difference. You know, women in rural India deliver in the fields, carry their child back home because a normal delivery is a God-made phenomena, whereas a Caesarean section is being created by humans when you do a surgical intervention, it is likely to give you much more pain after the intervention has been done. Whereas in a normal delivery, whatever pain has to happen, happens before the baby is born.
Correct.
After the baby is born, there are no more pains. You may have a little pain in the episiotomy from your stitches, but it doesn't compare with the pain that you may have with a cesarean section. And with the cesarean section, you would need much more care subsequently. You need to take care of the stitches. You need to make sure that the patient doesn't get much infection. You need to make sure that the patient gets an adequate amount of rest. She doesn't start exerting so that she doesn't get herniation. So there is a lot of care to be taken for a cesarean versus a normal delivery.
And one of the common questions that moms always have is that, is it possible to have a normal delivery post having a C-section?
That depends on the reason for which the cesarean section was performed. In case the cesarean was performed for what we call a recurrent indication, which means that the reason for which the cesarean was done is not going to go away. Which means, like, if a lady has a bony structure which is narrow and the baby's head cannot negotiate that bony structure, in that case she will always have a cesarean. However, if she has had a cesarean for a non-recurrent indication, which means that, okay, this baby was upside down, or if in this particular pregnancy she had XYZ problem, which may not occur in the next pregnancy, and if the next pregnancy is going on well, then she can have a normal delivery. And when we have such a patient, we counsel her and we do what is called TOLAC, trial of labor after cesarean. So we give them a trial of labor, we watch them carefully so that they are not endangered in any way, and if the labor goes well, yes, she can have a normal delivery.
Don't forget to subscribe to our channel to get more information on videos like this, and do share this video with your friends or family who may benefit from the same.